All right, what is up, everybody? Today, I want to talk about Medicare in conjunction with foreign travel. So, if you go outside of the United States and specific territories that the U.S. has, so um, it's a really important conversation to have now that, you know, a lot more people are back to traveling and everything post COVID and all that. So I want to talk about a couple of things. So, number one, if you're going on a vacation outside of the 50 US states, okay, um, you've got Puerto Rico, US Virgin Islands, Guam, American Samoa, and Northern Mariana Islands. Okay, those are your US and quote territories. So if you have Medicare, you got a Medicare plan. If you're in any of the territories, you're good to go, just like if you were in the 50 states. Now, outside of those areas, okay, you have very limited coverage through Medicare A and B, or if you have a Medicare Advantage, PPO, or HMO. Okay. So with original Medicare A and B, you've got a lifetime benefit of $50,000. That will be gone in the blink of an eye, basically, if you got inpatient hospital and anything major that happens, any of that stuff. So that's an important consideration in and of itself. But you also need to understand that foreign facilities, like foreign hospitals, like let's say you're in Europe, you end up in a hospital in Spain, something like that. Foreign facilities aren't required to file Medicare claims for your medical costs while you're traveling. You would then need to submit an itemized bill to Medicare when you get back for doctor, inpatient, ambulance services. Okay. And that can take weeks to months to process. You've already had to pay everything out up front. You get the idea there. Okay. Um, so because Medicare has limited travel coverage outside the United States, I always recommend, and I can, run quotes for you, get a policy in place if you want, but travel health insurance. And the reason that you want international travel health insurance is that, let's say you are also, I think another good example is if you're on, people people ask about, well, what if I'm on a cruise ship? Well, if the cruise ship is far enough away from port, and I can't remember, it's a few hours or something like that, you are then internationally traveling. So again, if you end up in the sick bay or whatever it is on the ship out in international waters, again, you've got very limited options for coverage with any kind of Medicare plan. So, if you've got Medicare Advantage like HMO, PPO, yes, you've got worldwide urgent and emergency care. That is certainly helpful versus just traditional Medicare A and B. That does help. But at the same time, you would definitely want to look at some sort of international travel health insurance policy. Because typically, like if you're going out of the country, you're going for at least a week, 2 weeks, whatever it is. And so you want to make sure that if you are hospitalized, if you need emergency services, prescription drugs, um, everything for evacuations, different things, um, you want peace of mind knowing that you've got some actual legitimate health insurance and emergency coverage. So, what is that? What does that look like and how does it work? So, I typically will utilize through Blue Cross Blue Shield. They have a plan called Geo Blue as a travel health insurance. Okay, you've got a few different options regarding how much coverage that you want. Everything from 100,000 up to a million. There's a few different deductible amounts, that kind of stuff. But it builds in certain things to ensure that you get proper coverage at a, foreign hospital emergency, whatever it might be. It's a plan that covers pre-existing conditions and things that could be, related to it, and a lot of these things that would be a necessity to provide you with peace of mind, because there is no guarantee of any kind of coverage with Medicare itself once you get out in the weeds of, needing major care or anything like that while you're out there. And obviously, we don't ever want to just anticipate something's going to happen, but you want peace of mind knowing that's true. Like even even going to Canada, which is, right next door to the United States, you could be, say you go, I don't know, fishing in Canada for a week or hunting or whatever, and you're over the border, you're up in, wherever you're at. It's good to have. And I would, recommend it because for for what you pay in premium, it's extremely reasonably priced. It's worth that benefit that comes along with it. So just understand with Medicare, if you're going out of the country, okay, you don't and you can't rely on your Medicare plan to do much of anything. Um, so, just keep that in mind. I will put link below with some information there where you can go take a look. They got a PDF, brochure which explains a little bit more. But I hope this video was helpful. If you got any questions on, you're getting ready to go out of the country, I do it multiple times through the year. We can run a quote, we can look at options, that kind of stuff. But again, for a very nominal fee to get comprehensive health insurance, plus there's a few extra bells and whistles like evacuation benefit and some of these other things, which would be extremely helpful to provide just peace of mind while you're traveling. Or I look at it, also the people who care about you, your loved ones, whether it's, kids, parents, whatever, if you're traveling overseas, um, that provides them with peace of mind too, knowing that, you've got additional coverage that's available to be accessed. So anyway, I hope that this video was helpful. How'd you think? And we'll talk to you again later. Have a good day.